a teeth neurology video series. Let's discuss peripheral neuropathy. Peripheral neuropathy is where you get symmetrical tingling, numbness, burning, aching feeling in the legs, mostly tingling, numbness, burning, and that is symmetrical. It's got to involve both feet, and it has to be really equal in both feet. It won't start, for example, only in one foot, and usually after a few years of affecting the feet, it can spread to the hands. So for example, if it only involves one foot, or if it starts in the hands first, it's almost never neuropathy. There is one type of neuropathy which will start in the hands first, but almost always neuropathy starts in the feet. Sometimes neuropathy from vasculitis can start very abruptly, but most often it's very slow, progressive, takes time, it gets worse over time. There are two types of neuropathy involving the small fibers and large fibers. Small fibers affect pain and cause pain and numbness, burning, and the large fibers are the ones which affect the balance. Especially when it's dark, when patients can't see properly, they feel very imbalanced. So neuropathy not only would cause tingling, numbness, burning, but can also affect your balance, lead to fall. So what are the causes of neuropathy? The most common cause is diabetes, by far. Also the most underdiagnosed cause. A lot of people, even with pre-diabetes, borderline diabetes, can develop neuropathy. And you got to look for the most common cause, which is diabetes, instead of thinking of other much obscure causes. But what are the other causes? There are many causes of neuropathy. Alcoholism can certainly cause neuropathy. Even say drinking 3 drinks a day can cause neuropathy. It's a cumulative effect, not just one time drinking, but it's years of drinking. B12 deficiency, thyroid dysfunction, kidney dysfunction, abnormal proteins, what we call as paraproteinemia, certain medicines, hereditary, the presence of cancer, certain toxins, many causes, autoimmune, there are many causes of neuropathy. How do we diagnose it clinically? So we, by examination, checking the reflexes, which should be sluggish or absent. If they are brisk, it's almost never neuropathy. And then nerve conduction studies, which we do in the office, as well as EMG, can certainly help to diagnose neuropathy. Sometimes we have to do a punch biopsy, especially to look for small fiber neuropathy. The treatment of neuropathy involves treating the cause. So we have to treat the neuropathy. Typically we have to treat the cause. If it's diabetic, it's almost never reversible. We also use medicines to treat the pain from the neuropathy, like the gabapentin can be used, Cymbalta, topical medications can be used, topical analgesics including patches, but that's only to treat the pain from the neuropathy. That doesn't really do anything to treat the neuropathy itself.